infertile seems like the end all, like that's it, like you just can't. And that's not true.
But you mentioned something that has stayed in my head and I have to get it out. You talked about there are men who do not want to submit themselves to the testing to figure out what their sperm quality is like or their sperm count, but them and their partner are trying to get pregnant, but they won't submit themselves to testing. Is that right?
That's right.
Christina.
On demand. That's the pressure.
A 2-cycle pack for $100,000. And yeah, it was amazing. It was pretty amazing. So I was like, yeah, sure.
Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness.
Welcome back, everyone. Birds, Bees, and Bodies podcast brought to you by Planned Parenthood of Southeast and North Florida. I am your host, VP of Communications, Michelle Quesada, along with my co-host, Clara Truyenque, also Communications Manager here with Planned Parenthood of Southeast and North Florida. And today we're bringing back our podcast to infertility. This is a topic we talked about back in December. We published an episode on infertility. It did very, very well. And we know there's a big appetite to talk about this. Today, we're diving a little bit deeper on just the differences of care when it comes to different communities and access to infertility care. So we're bringing back Dr. Cherise Felix, who was with us for that initial infertility podcast. Dr. Felix, thanks for joining us. Always appreciate your time here.
Thanks for asking me to come back.
Absolutely. And we also have Christina, who is our Vice President of Education and Diversity, Equity, Inclusion, and Belonging at the organization. And Christina brings a different perspective to how access in marginalized communities and in minority communities is impacted, and also has a personal story that we'll chat about in a bit. So for the listeners who didn't get to listen or partake in the previous podcast on infertility, let's just kind of set the tone real quick and talk about what is infertility, Dr. Felix, and how do you diagnose it?
Technically, it's diagnosed if you have 12 months of unprotected sex without a conception. But if you're timing your intercourse, so if this is, a planned pregnancy and you're paying attention to when you ovulate, so intercourse is timed in accordance with your ovulation, then if you haven't conceived in 6 months, then you're considered infertile. And I hate that title. I also want to say that, like, infertile seems like the end all, like that's it, like you just can't. And that's not true. It's a diagnosis, but it's not permanent. So your infertility can be treated, it can be reversed. It might be as simple as supplements, during a certain time in your cycle. It might be as complicated as, needing a surgical fix, but infertility doesn't mean that you are forever doomed to not conceive.
Yeah. And so let's change that narrative and let's say it's a period of infertility that you're going, right? So
Sure.
it's, because there are people that have had issues getting pregnant or staying pregnant, for their first pregnancy, and then their second pregnancy, like, boom, they just get pregnant out of nowhere and they weren't even trying. So yeah. I think it's a period of infertility, right?
Yes. And if we think about our lesbian population that are having to go to infertility clinics to help get pregnant, no, that doesn't apply either. So, it's possible. Just sometimes you need a little assistance getting those pieces together.
Absolutely. And talking about infertility, I know that it affects millions all over the world, right? But I would like to ask you, how does this affect different populations? Like, are some groups more prone to seeking fertility care than others? And why is this?
There are so many reasons. Where I went to medical school, it was in the mountains in Tennessee and Appalachia. And there were a lot of environmental factors that played into healthcare. That medical school and that community was built around massive, photography production centers. They produced lots of chemicals. There's a lot of chemical leakage into the water supply. There was an infertility problem. So it can be, something as personal as an untreated pelvic infection. It could be something as out of your control as where you were born and the water supply that you had, and then anywhere in between. Sometimes genetics play into it. So it's hard for me to sort of talk about subpopulations for infertility, but we could talk about subpopulations that seek care for infertility, because I think that's stratified more so based on your means, right? So your education level and the amount of money you have, and how seriously you're going to be taken at your doctor's office when you show up. There's a little bit of judgment there. Can you afford this child? I've heard those discussions from other doctors before, like, well, that patient still has an outstanding balance, but they're coming back for fertility care, like those types of things. So it's a very sensitive treatment. The whole process, you have to feel valued from start to finish, and you have to feel validated from start to finish in a non-judgmental place. And so that's not always accessible. You may have a fertility clinic in your neighborhood, but that might not be the right place for you. So it's nice that, Planned Parenthood is out there bridging the gap for people. I think there are a lot of people that trust us. There are a lot of people that have private insurance and a private OBGYN, but I still see them in Planned Parenthood because they needed to come for something else, or they weren't comfortable talking to their OBGYN. That OBGYN also treats their mom, and they didn't, like, there are all sorts of things that go into why people maybe don't want to go to their primary OBGYN. So Planned Parenthood is helping that a lot by just, being there to help with evaluations and diagnoses and discussion about, like, what's best for you, like what's the next best step.
We'll talk about what we offer. I wanted to bring in Christina in this conversation because there's a lot of stigma attached to getting fertility care, depending on what minority group you belong to or what ethnic background you belong to, right? I mean, I see it all the time as a Hispanic. For me, it was like when I went through, and it wasn't even infertility. I had a couple miscarriages, which are very common in pregnancy, as we know. And it was like, what is my body doing wrong? Like, I'm Hispanic. I should be popping out these babies like Tic Tacs. Like, you know what I mean? Like, why, what is going on? Christina, do you hear the same thing?
Absolutely. And I think part of that, like, infertility really causes like no significant stigma, but it's really about the silence, really, that shame, the isolation. And so speaking for myself, having experienced infertility and going through fertility treatment twice, it was just hard to speak about. And so part of that shame was like, kind of like what you were saying. I felt like I was supposed to get pregnant. I did everything right. Why is it not happening? And I was ashamed of it, and so that's a big part of why people don't want to talk about it, and silence, because for the same thing, you don't want to talk about it, especially in certain communities. I would say, particularly in the Black community, it's just not heard of. But what I realized, the more people talk about it, the more we share, the more people are willing to say, hey, you know what? Let me go seek care and see if this is something that I can get help with. Absolutely.
The education part, right? Because I feel like in other communities, and we can talk about how that role plays in race and ethnic background, but more privileged communities, like fertility care is talked about, and there's access because there's money behind it. We have the funds to get this care. When you're looking at other marginalized communities, it's not not talked about enough. And B, it's like, well, if I have to get it, I don't have hundreds of thousands of dollars or tens of thousands of dollars to get this type of treatment. So cost is a barrier and plays a barrier in these racial inequities like that. That's what we're seeing as well.
Yeah, and I think it's a trickle down effect. I think about myself, right? When I was diagnosed with pituitary adenoma at 27, and one of the first things they said to me is like, it may cause infertility. So just being able to have access to that care back then, immediately, by the time I was ready to conceive and plant my parenthood at 31, I'm like, you know what? I had access to care. I knew what I needed, and so again, when I say trickle down effect, all of those things matter, right? And so a lot of people don't have access. If you can't have access, there's a lot of Black women who have fibroids and all these other things that's going on. If you can't deal with those things, then how can you really get to truly dealing with your infertility issues? And so because I had access, because I stayed with Job College, right, when we talk about education, I remember being in some of those appointments and thinking to myself, oh my gosh, if I didn't have a chemistry, a biology degree, like some of this stuff would go over my head. So sometimes just being in those appointments make it hard.
I definitely agree and validate everything you're saying. And Clara, you have some experience too with just the cost of itself. I mean, I think about, you know, people who try to plan this out. Like there's many people who go through periods of infertility, right? Like something unexpected came up. They didn't know by the time they were having kids. They're like, why can't I get pregnant? And there's people who plan ahead and who get fertility testing and they want to know kind of where they stand, what's their ovarian reserve, you know, what's the sperm motility look like? Because, you know, in a few years, I want to try to have a family. But then when you go to look at what it actually costs to do that, you fall out of your chair.
Oh, it's crazy. It's actually so. It's just what you just said. Suddenly, something comes up, right, and they tell you you need you need to go to a fertility clinic because I have some myomas and my low reserve, my ovarian reserve was very low, and this was something that happened out of the blue because a year and a half before that time, the ovarian reserve was just fine. So we don't really know what happened, but it happened. And yeah, the first thing we did was going to a fertility clinic here in Miami. And the first surprise was that I was told maybe the first cycle does not work. So we are already offering you a 2-cycle pack for the affordable price, which is something that I brought up to my doctor in Spain, and I'll tell you about it too because it's pretty interesting. I was like, okay, so the first time it's not gonna work. No, normally it doesn't work. So I'm gonna offer you a 2-cycle pack for $100,000. And yeah, it was amazing. It was pretty amazing. So I was like, yeah, sure. So how can you pay this, right? And they were like, well, we work with 3 different banks. You can apply and see if you get approved. So yes, we have stable
for a loan.
Right? Oh, of course, for a loan. I mean, who has 100,000 just here at home or what in the bank ready for a fertility treatment? So when you call the banks applying for this amounts of money, they are so used to this and they think it's so normal to apply for 100,000. It's not like 10,000. We're talking about 100,000, like half of the payment of a house when you buy a house, sometimes in some areas of the United States. So we were like, okay, how can we pay this? And they were like, well, you have 2 years to pay it. Otherwise, the interest, it was like 23% interest. Gosh. How are you going to pay in 5 years, 10 years, 100,000? So basically, the next step, even though we did all the blood test here in the US to know what's going on, how ready we are, how many problems we have. I talked to the best clinic in Spain, where I am from. I called them. I was referred by 2 of my friends who got pregnant thanks to them. And I said, hey, what are your prices and the successful rate? Because I was concerned about those 2 cycles. So definitely, we did it in Spain. It costed a fourth of the price. And with the 2 cycles, by the way, well, I didn't need 2 cycles. I did 1.5, let's say, because of a little problem. But doesn't make any sense that they sell you the idea of the first stimulation is not going to work.
And then if it does work, then you're getting
extra. Yeah, you just got $100,000 loan that you have to.
Yeah, but if they sell you a 2-cycle pack, if you get pregnant with the first cycle, right, you're losing tons of money.
Absolutely.
And time. And then you're like, how about that? And then the answer is you are lucky you got pregnant at the first try, but we weren't sure about that. And
let's rewind that for a second, because you're talking about like someone who has credit history, someone who has, you know, history of working, you know, stable employment. Let's look at somebody who doesn't have that, who doesn't have credit history, who doesn't have stable work employment. What bank is going to give them a loan to get fertility care? And so the options are already cut off for anyone who's in that predicament. Like unless you have cash on hand, there are no options for you. You don't get the chance to start a family.
No, most of the people in any country, but especially here that we work on credit scores, there is no way that most of the population can get a loan to have child through a fertility center, because as you are saying, not everyone has 800 credit score, or the ability to get a loan, a personal loan for this, or the ability to pay off the loan within 2 to 3 years.
Yeah, right.
Yeah. And I think that goes back to why marginalized folks get left out, right? Because it's really hard. And I had a similar experience. Like, you pay for two. If you pay for one, it may not work. You pay for two. Mine was a little bit different in cost, but I went right here in Boca. But the whole process was about $35,000. But just for the 2 cycles alone, it was $20,000. If you did one, it was 15 or something like that, or 14 or 13. But it was additional 7,000.
That's a good deal.
Right.
That's a good deal.
And then you're like, well, we might as well pay the additional $7,000 because we're saving $8,000. But of course, I was lucky; it worked on the first time, and that was a full cycle of IVF. I had my first child through IUI, and then my second child through IVF, and so.
And so
it's good to know that this that Christine is talking about, you have to see the differences also between IVF, which is what I did and is the most expensive treatment, and the other one is
why
affordable. Yes.
Mm-hmm. You get both. Christina has done IUI and IVF.
Yeah.
So
and I've done IVF.
You've done IVF as well. Yeah. And let's not even talk. We haven't even talked about the stress involved in that process and the amount of I guess just work that your body has to go through, right? Because they overstimulate your egg production, and there's all these things you get put through, right? Injections, tests, getting lab results, like undergoing pelvic exams, everything that you have to go through in order to just get to the point of extracting the eggs, fertilization, implantation, all of that, to then find out, okay, did it work? Before we get to all that, like this process is just not accessible for people. I want to spend a little time to chat about what we do at Planned Parenthood of Southeast and North Florida, and how we help people we offer basic infertility treatment. So we don't do IVF, we don't do the IUI right now, right? There's always hope that we can expand and do more. But at least some of that testing initially that may cost you hundreds of dollars going to a clinic. And I want to preface this by saying, I don't want to put down fertility clinics, because they are amazing. They help so many people get pregnant, and there's so many great clinics out there that work with you financially and are able and are affordable. Obviously, there's some that are more high end, or others that require a lot more finances up front. Because this is a business. Let's be honest. In the United States, this is a business. Having a baby is a business now, right? And we have to put that out there. But, we help you at Planned Parenthood kind of get the initial testing just to kind of see where you are and what the problem is. Dr. Felix, if you can share just a background on the evaluation process and how we can help you kind of figure out, okay, what the path forward looks like for you.
I think for even when I was in private practice doing this type of work or infertility work, the most important part is just having somebody sit down with you and explain your cycle to you. Because it's not like if you Google it, it's not going to be the same for you. And so sometimes if you're just looking at what's your ovulation pattern? How are we going to track this? There's a lot of women out there with PCOS that don't have regular ovulation events. And so for them, tracking that sometimes can take months to try to figure out where you're going to, when you ovulate, how strong that ovulation signal is. So at Planned Parenthood, the first thing that we do is just sort of get your history, give it all to us. Tell me everything you've been through, everything you've tried. How long have you been trying? How many partners have you tried with? Has that partner fathered children before? There are all of these little bits and pieces that go into it. Should we be more focused on the woman, or should we be focused on the man? That's in this. There's male factor infertility. And there's a lot of men that aren't willing to go the extra mile to try to figure out what's happening. I don't know the psyche behind that, but there's a lot of men that feel like, that's not a problem for me, or they will not submit to semen analysis. They just don't. And so it's helpful to have somebody with a background and knowledge for, hormone cycles and ovulation cycles, just look to see what your history is, because it's a story that we put together retrospectively. We can't predict what's going to happen in the future unless we can understand what your personal past has been. From there, we'll test your hormones to see if you're ovulating on your own, to see if your progesterone level is strong enough after ovulation to support a pregnancy. If you have PCOS, we can offer treatment for that. But we're sort of the first stop in that analysis before you have to go spend the big bucks at an infertility clinic. And a lot of times that workup, if we've paid attention to your history, does not always fall under your insurance diagnosis of infertility. So if you're not ovulating with regularity, then the diagnosis code can absolutely be ovulatory dysregulation or menstrual irregularity, something like that, something GYN, so that insurance will cover part of that workup. Once that workup is complete, if we don't have a diagnosis for why you're not ovulating or why you're not conceiving, and then you have to rely on an infertility diagnosis at that point. But once you have that infertility diagnosis, that's when you know you need to move on to an infertility clinic. And they work magic. They're fantastic. But they do require a lot of work up front to speak on their behalf. An infertility clinic is going to be popular or driven by their success rate. So they have to sort of level the playing ground for all of their patients that are coming in. They want that HSG to make sure that your fallopian tubes are open and the uterine cavity is normal. They want the ultrasound, they want the blood work, they want all of those things before they start treating you. And those cost a lot of money. And it's coming from an infertility doctor. So those clinics are going to try to use your insurance as well. They will go the extra mile for you to try to get things covered, but their process is different. So if we can get that workup done at Planned Parenthood beforehand, then it's helpful, and sometimes it's cost effective. Most of the time it's cost effective. And then you're better equipped going into an infertility clinic. So when they start double talking you about, hey, I need we're going to sell you 2 rounds of IVF, maybe you can say, well, I have this amount of information already. I've had these discussions with, my practitioner at Planned Parenthood, and I'm not sure that that's the best financial decision for me right now, but I do want to proceed with 1 round of IVF. Or, based on your workup, you may need that package, get that 2 for 1. Or there's some.
Or it could just be IUI. It could just be, a sperm motility issue and putting the sperm closer to the uterus, and you don't need to go through all of IVF.
Right. And I'm hoping by the next podcast, we'll be offering something like that. So
yeah, me too. I wanted to go back to something you said, because I do want to touch on different treatment options and how there might be simple fixes to what's going on. But you mentioned something that has stayed in my head and I have to get it out. You talked about there are men who do not want to submit themselves to the testing to figure out what their sperm quality is like or their sperm count, but them and their partner are trying to get pregnant, but they won't submit themselves to testing. Is that right?
That's right.
Christina, is this I'm pointing at you because, you have a DEIB perspective that can be included in this conversation. But is this part of the whole, we don't need medicine to get us pregnant? I can do it. I'm a man. I can do this on my own. Is that part of that type of mentality? Or is it just a fear of going to a doctor and doing anything and having someone check your sperm? Where is this coming from?
I think it really goes back to stigma, right? And really lack of awareness. And I think some men may feel like it takes away from my manhood. Oh, it's not me. It's the other person. It's her. Right. And so and that's the tough part. Sometimes it's hard for men to go to the doctor just to get a prostate exam. So now saying, hey, something may be wrong with my sperm or something like that. I think that comes with that shame and that stigma and just I don't want to deal with it. I remember when my husband went in and they were start asking and they got the sample. Although he didn't say it, but I could see the look on his face. I think there was some worry there, but also just, and I'm like, hey, if I have to go through all of this, all the exams, the pelvic exams, you can do it too. And so he was comfortable with it. But I do think me being in the education space and talking about it, it made him more comfortable. And so a lot of people don't have that thing. obviously me working at Planned Parenthood, I talk about ovaries and uterus all the time. So I think he had a comfort because of where I work and what I do. For many men who aren't exposed to healthcare in any capacity at all, I think that that stigma and shame keeps people from seeking treatment. And we know like infertility in men could account for about 30 to 50% of the cases. And so if they're not willing to do it, then that person, their partner, can keep going through these treatments and it's still not working because part of the problem is them. And so,
men, if you're listening, okay,
yes.
if your partner is willing to be poked, prodded, checked all the time, lab work, getting injections, going through pelvic exams, ultrasounds, surgeries, right? Because sometimes you have to go through surgery to get rid of cysts or anything else that might be obstructing. You can submit to a sperm test. It is
I have to say, like, again, for private practice, like handing him a cup and having him go to a back, like that's a lot. It's actually
hold on a second.
pressure.
Is there an option to pick up the cup, go home, do your thing, and bring it back within a certain amount of time?
Yeah, but you can't always do that. You cannot always get it back in time.
Yeah, I think based on the fertility clinic, I think ours, they allowed it, but it had to be within a certain amount of time, and we live very close to the fertility clinic, and so they would allow him to submit the sample at home, but it was like a rush to get it there.
Get it there within the hour or something, right? Like
it was like less than 30 minutes. It was less than 30 minutes time, but the idea of him having to provide a sample in clinic was tough for him. And so
on demand. That's the pressure.
Yes, absolutely.
Go guys.
It wasn't the clinic in our case, and they said,
there you go. Your business.
Go that way, you go to the right, to the left, you go to
that. That's
okay. That is hard. I'll give him that. That's difficult.
They provide you with a room, with magazines, a TV, and all that. Come on, how about
I just want you
to go through all those little cameras they put in your down there to check the hysterio, a test with a camera down there to see how the uterus is and all that. And they are
none of this is comfortable, is what we're trying to say. None of this is comfortable for either person. So there's got to be some sacrifice and there's got to be some willingness.
And I feel like I have to drop this in the chat because we're all women, and I'm an OBGYN. So I've my training has been on women my whole career, and I've taken care of women my whole career. And then I start working at Planned Parenthood and I get training on vasectomies, right? And something that never even entered my mind was there are men that go get vasectomies without their wives knowing. And then they will not submit a semen sample after. And their wives are not getting pregnant after. And when I was doing these, when I was going through the training and those men were coming in and my mentor was asking, like, how many children do you have? Does your wife know? Like questions that we would not ask at Planned Parenthood, right? But my trainer asked those questions. I was shocked to see how many men were there. Do not call my house. Do not send anything. Do not send mail to my house. My wife does not know. And they would get a vasectomy and be done. And there's, there's no stitches. There's no scar. There's no.
Right, you can't tell. You wouldn't know, right? When you heal, you heal. That's it.
That's right. That's right. So that never entered my mind until I had the exposure and the training. And I never thought for some of those women that I was taking care of whose husbands would just refuse to come in and give a sample. I never thought one time, well, maybe he's had a vasectomy, but
doesn't want to tell you about it. It's too afraid to tell you about it.
That's happening. Yeah. They're right? Like if it was reversed, we should not have to have permission from our husbands to have a tubal ligation to control our reproduction. So,
it's an honest conversation you have to have with your partner, especially if you've talked about having children or not having children. That should be a conversation every couple has at some point. Right. Because the last thing you want to do is commit to yourself to someone and then find out you're not on the same page about, having a family.
That's right.
But I want to go back to the conversation about treatment options and how the type of testing we do can sometimes lead to very simple fixes that you didn't know. Just by changing this or doing this or trying this, you can get pregnant and you don't have to like submit yourself through, through all this fertility process.
Well, my favorite one is luteal phase defect, where you just don't make enough progesterone, so you get pregnant. Patient will get pregnant, there'll be implantation, but there's just not enough progesterone that's being produced from the ovary. So the progesterone initially comes from a corpus luteal cyst that's in the ovary, and that corpus luteal cyst arises after you conceive. So that secretes the progesterone that supports the pregnancy, but sometimes it's inefficient. And if it doesn't secrete enough, you'll lose your pregnancy. And so that history looks like people coming in saying, my cycles are really irregular, or I had a positive one day, but it was negative the next day, like those types of scenarios. You're losing a pregnancy before you can test positive or shortly after you test positive. And the simple fix for that is that we just give you a prescription for progesterone and support you until you grow a placenta. Once you grow a placenta around 12 to 13 weeks and it's functioning well, you don't need the progesterone anymore. And so that is one of the most beautiful things that we can do to help with your temporary infertility.
Amazing. And I want to say we offer prenatal care up to 14 weeks as well. So if you do get pregnant, we can help you initially to make sure everything's going right, all the tests are being done, all that good stuff.
Absolutely.
Thank you all so much. This was such a great conversation. Is there anything else you'd like to add?
I think I would. I think the one thing that I don't want to forget about is really like the LGBTQI inclusion, right? And so there's still systemic barriers, right? So I know this is partly heteronormative conversations, like when we think about man and woman, but they're discriminatory in insurance coverage and hurdles and people who give GAT services. And so I think and a lot of times LGBTQ folks need like that assisted reproductive technology to really help them build their families. So I think in this conversation, we can't leave them out, because really coming from an inclusion lens, right? And it's not even just LGBTQ folks who have long health issues, right? I have a friend who has lupus, and it's been really hard for her to get pregnant. And so part of that, not having the conversations, or physicians not having a conversation, hey, we're going to send you through chemo, we're going to send you this. Maybe you should reserve your eggs, right? And so I think a lot of things and a lot of conversations aren't happening in the medical community, and particularly in the marginalized community, the Black community, the Hispanic community. People are not stopping and saying, I know you have this, we're going to do this treatment, but hey, have you ever thought about reserving your eggs? Have you ever thought about protecting? Because you may be going through this now, but 5 years from now, you may want to start a family. So what does that look like for you? And the same thing, if a trans man wants to have a baby, before they have services, hey, should you be reserving your eggs? So I think that's an important part of when we talk about infertility or fertility in any way. We need to make sure that everyone that wants to get pregnant have access to it. And so it's just an important part of the conversation. I just want to make sure we don't leave out.
Yeah, and that's such a great point too, Christina, because we talked a lot about like couples that already have, a sperm donor with them as they go through this fertility clinic. But what if you don't have a sperm donor and you're going through a sperm bank? That changes the access and the costs and everything else associated with the fertility treatment. So that's a great point. And then there's also couples, LGBTQIA couples that may be going through surrogacy and have someone else who's going to carry the pregnancy with their egg and with a sperm donation. So there's just all these different dynamics and complexities when it comes to fertility care for different groups of people that I think makes it even more of an inequitable process when you look at what access we have and under the current system right now.
Yeah.
Those are things to think about.
Yeah, and that all goes back to socioeconomic inequality, that inequity, right? As you add these layers, when you look at the intersectionality of it, all those layers make this process more expensive. And so for me, I was lucky, it was very easy, right? I had a partner, but for other folks, you add 3 or 4 more layers, that can raise the price $100,000, $200,000. And when we think about it, even for me, that would just been an impossible task. And so I think that's what we have to really think about. And I would say, folks, if you listen to this, ask those questions when you have the opportunities. Really push and be an advocate for your own health care. If whatever you're going through, really be an advocate for yourself and ask those questions. And what does that mean for you? Even for myself, I have a lot of my friends that I went to college with, they have children later on in life. And so I'm really pushing them, have those questions, think about it. Because women are having babies later and later, or folks are having babies later and later. So what does that mean? Back in the day it was 21, 22. Now it's 34. I had my first at 34, my second at almost 39. And so even from 34 to 39, it was a big difference in what my fertility looked like. And so just want to make sure we don't forget to mention
that's such a great point. And yeah, and I would even add to that, even if you are in your 20s and you want to have a family someday, like there's nothing wrong with going through this process and reserving eggs if you're able to do that now, because you don't know what the future looks like. Like I always knew I wanted to have a family, but I didn't meet my husband until I was 28. We got married when I was like 30. We didn't want to have kids right away. We waited. Luckily, like we were able to have two beautiful boys, but it's tough because I don't know what if my fertility had changed, and now I'm faced with this situation where I have to jump through all these different hoops to be able to have a child. Whether if you know that earlier on in life, I don't think we think about these things when we're in our 20s. It's the furthest thing from our mind sometimes. If you're career focused or you're focused on something else, and you're not ready, or you're like, oh, that I'm gonna be fine by the time I go have children. Not all the time. Some people, yes. Some people have no issues, but
yeah, I got busy with medical school and then residency. Finally, my daughter was like, if you don't do this, like, I'm not going to know. Like, but I was single. I really did not believe that I would meet a partner that would partner with me through, parenting children. And I was right. That did not happen. So I did this like solo, but I was so fortunate to know, my age, like it's crept up on me. I was 37 at the time. I was like, oh my gosh, like, my window is closing. So I was fortunate enough to know a little bit more than the average person and got it done. But yeah, like careers and life, and then just parenting my first child, I was busy and I just, the time just slipped by. And before I knew it, I was fantastic, but I was 37.
And you had twins. And you had twins.
With the infertility treatment. Yeah.
I think that's so amazing that you saw yourself in a position where, like, I know I want to be a parent to another child again, and I'm still going through my career, but I'm going to do this whether or not I have a partner or not. I think that is amazing, and I really hope that more people get encouraged to do that with or without a partner. Obviously, we always look at ourselves and we're like, well, ideally, I want to do this with someone, and parenting is hard. You do want to have a village to rely on.
Yeah.
But that shouldn't be the reason why you do or you don't become a parent, just because you don't have a partner at the time that aligns with you.
That's right. And I was running out of time and needed fertility assistance at that point. But you just get busy and life takes over, and life's hard sometimes. So just being able to stop, I didn't have that partner, but I had that daughter that looked at me and was like, Mom, you're gonna have another time. I'm sorry.
That's okay. Thank you all so much for your time today. I just want to put it out there that if you want to learn more about our infertility care services, please go to our website, ppsenfl.org. That's like Planned Parenthood Southeast North Florida.org. And we also have social media handles you can follow us on. We have all of our information on all the services we provide on social media. We talk to our doctors. We have patient testimonials, all that stuff that you want to get from us at PPSENFL. We're on Instagram, TikTok, Facebook, Threads, you name it. We're on all of them. So thank you so much for your time. It was such a great discussion, and I hope we can do it again soon.
All right.
Bye.